Thank you. There are over 93,360 estimated cases of MRSA and over 19,000 deaths reported each year in our country alone for MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. It's a bacterial infection that has become resistant to several antibiotics. Research shows that the spread and the incidence of MRSA can be reduced by more vigilant hygiene and better education on the proper use of antibiotics. Practicing proper hygiene is probably the best and most effective way to protect yourself and others from spreading germs. Hand washing is the best way to stop the spread of germs. Proper hand washing includes 15 to 20 seconds with warm soapy water or use of an alcohol-based hand sanitizer. Environmental hygiene includes wiping down surfaces and commonly used items with a sanitizing cloth to prevent the spread of the MRSA germ, because staph and MRSA germs can last on doorknobs, telephones, counters, any surface for weeks, according to Dr. Moore on her website, staphinfectionsresources.com. I'm now going to present my visual aid. It's called Hygiene, and it says proper hygiene will decrease the spread of MRSA. The first picture is an example of personal hygiene. It's a nurse washing her hands properly, 15 to 20 seconds with warm soapy water or using a alcohol-based hand sanitizer. The second picture is an example of environmental hygiene. It's a person wiping down a phone. Wipe down all surfaces and commonly used items at the start of each workday, because anyone can be a carrier of MRSA. The second part of my presentation is about the education on the proper use of antibiotics. The improper use of antibiotics has led to an increase in MRSA. So education is the most important part of stopping the incidence, the increased incidence. Education starts with the patient. You need to explain to them that antibiotics do not cure viral infections. They are not effective against viruses. They are only effective against bacteria. So they need to not pressure their doctors into giving them antibiotics for when they have a cold or a viral infection. Even children that had ear infections in the past have been routinely given antibiotics. They're proving now that the majority of the ear infections in children are viral in nature. This is from the Mayo Clinic website. It's called, the article's called Antibiotics. The second part of the education goes to the physician. They need to be instructed not to give in to their patients when they request antibiotics, when they know that they are not warranted, because it's just increasing the incidence of the MRSA. They instead can tell them how to treat the symptoms, such as using a saline spray for a stuffy nose or salt water for a sore throat. And this will decrease the incidence, because you're not giving antibiotics, randomly to patients. So the research has proven that MRSA can be decreased by proper, more diligent hygiene and education on the proper use of antibiotics. MRSA is not just an issue in our country, it is global. The incidence is increasing. The superbug is increasing over the world because of all the different antibiotics that people are taking and improperly using. So it is a global world problem that needs to be dealt with. It is a treatable disease. If you catch it early, if the patient's healthy, it does have a good prognosis, but if you don't catch it early, it can result in the loss of a limb, organ failure, and even death. Thank you. This concludes my presentation. Are there any questions? Yes? What are the risk factors for MRSA? The highest risk factor for MRSA is coming in contact with the person with MRSA, or touching a surface that they've touched. That's the highest risk. Another risk is having a break in your skin and having contact, a germ getting in. That's why patients that are in the hospital are at high risk, because they have incisions, they have IV sites, catheters, and if staff are not practicing proper hygiene, they can transmit the disease. They can transmit it to the patient, and it occurs quite frequently, unfortunately. On the other side of the coin, the staff are at risk because patients have MRSA. The ones you know, you can protect yourself. The ones you don't know, if you don't practice proper hygiene, you are at risk. Another group at risk is the elderly, infants, and people with decreased immunity, such as people with different diseases, or if they're on chemotherapy, something like that. Okay. Yes? How is it treated? MRSA is treated by antibiotics, but they have to determine which antibiotic this particular bug that you have is sensitive to. So they perform a test called a sensitivity test, and then they determine which antibiotic is effective against it. So if treated early, it's very treatable, and it can be given orally or through an IV, depending on the severity and the health of the patient. Yes? The prognosis? The prognosis is good if it's caught early. Like I said, if it's caught early and given rigorous treatment, the prognosis is good. It's not so good if it's not. So it all depends on if you treat it early, if it doesn't become invasive and become pneumonia or sepsis, which gets into the bloodstream. If that happens, there is a 20% chance that death will occur. Any more? Okay, thank you.